With Cenegenics Carolina's Live on gastrointestinal issues. What's up with your gut? On the line, we have Dr. Brian Miles, Cenegenics Carolina's age management physician, as well as Tiffany Jackson, Cenegenics Carolina's nutrition specialist. Please stay tuned to ask your questions of Dr. Brian Miles and Tiffany Jackson after their presentation.
Good evening, everyone. Thank you for joining us. Welcome to our July webinar, What's Up with Your Gut? Gut issues are at the root of most allergies and autoimmune disorders and chronic conditions. Approximately 70 million people in the U.S. are affected by gastrointestinal diseases, and 40% of them are adults. According to the American College of Gastroenterology, gut diseases are responsible for the hospitalizations of more people in the U.S. than any other single group of disorders, and this accounts for approximately 60 million physician visits annually. So tonight we have Dr. Brian Miles on to discuss why so many people suffer from gut disorders. So welcome, Dr. Miles.
Thank you, Tiffany. This is certainly a passionate topic for me, and I'm excited to teach our listeners a little bit about how to restore their gut health. Here at Cenegenics, we see many patients who have suffered from chronic gastrointestinal disorders. Some of them may be irritable bowel syndrome, Crohn's disease, ulcerative colitis, and the like. A lot of times they think that they're eating the correct foods, exercising, taking supplements, and the medications prescribed by their doctors, but they still don't feel any better. Unfortunately, unless your intestinal tract is lined with an adequate amount of healthy bacteria, your body simply is not able to properly digest the vital nutrients found in your foods, the supplements appropriately, and the medications that they may be taking. So tonight we're going to talk about the gut in detail so you can hopefully have a better understanding of what is up with your gut and how to get it functioning better. During the webinar, we'll be referring to the gastrointestinal tract as the gut, and this may not be 100% perfect for purists out there, but it's a common term that we all know what we're referring to.
All right. Well, thank you, Dr. Miles. This is a very passionate topic for me as well as a naturopathic doctor. We believe and are trained all disease begins in the gut. It's a quote from the master doctor himself, Hippocrates. He recognized centuries ago that in order to maintain good health, you have to keep your intestinal tract, known as your gut, extremely healthy. So since I've been here at Cenegenics, I have seen so much success with our patients with balancing their hormones, correcting nutritional deficiencies, and giving the body the correct support it needs to heal their GI tract. So I'm really glad that we decided to do a webinar on this and teach our listeners our approach to healing the gut. So let's go ahead and get started. All right, so Dr. Miles, why don't you go ahead and just give us an overview of the digestive tract?
Sure, Tiffany. As you can see from the slide, the gut is divided into four distinct parts. The esophagus, which carries food to the stomach, which mixes food with digestive enzyme, it writes it down into a more liquid form for absorption. Then the small intestine absorbs most of the nutrients, and as it passes on through the colon or large intestine, reabsorbs water and eliminates the indigestible foods and residues. One of the most important functions of the gut is that it contains about 70% of the immune tissue in the body. A few other interesting facts: the gut is one of our largest interfaces between the outside world and the human internal environment. And from the mouth to the anus, as you can see on the slide, it's about 9 meters long. And over a lifetime, approximately 60 tons of food will pass through the gut, and it may be more in people who are eating a lot more food or a lot more indigestible food. It's certainly important for our well-being for whatever passes through the gut to be normal, to help to not constitute a threat to our health.
All right, well, that's a really good overview. Well, let's go a little bit deeper into the gut, and why don't you talk about the microflora and what goes on there?
Sure. As you can see from this slide, we'll talk about it a little bit. The normal microflora of the gut is an ecosystem which is composed of over 500 species of bacteria, and many of these bacteria are beneficial, and they actually form a symbiotic relationship with us as human beings. It's estimated that we may have up to 3 pounds of bacteria in our gut, and each person has a different gut microflora. So when certain organisms overgrow, it can disrupt the balance in an individual and cause problems in their gut. The balance of the bacteria can change depending on a variety of factors such as dietary factors, lifestyle habits, and the normal bacterial flora in the gut becomes a basic defense mechanism for the body against pathogens which may cause infections. The role of crosstalk of the microflora in the gut, as you can see from the slide, the bacteria are adherent even right to the epithelial lining. And this is important for stimulation of the immune system, synthesis of some vitamins, inhibition of pathogens, as we mentioned, and digestion and absorption of nutrients.
Yeah, I really like that picture of the slide because it really does show how the bacteria and that lining really do communicate there. So what can disrupt this communication and disrupt the flora here of the gut?
Well, we can see from this next slide that there are factors that alter the microflora. Antibiotics are one of the most common culprits that alter the gut intestinal flora. They can also lead to overgrowth of microorganisms, and some of them will release toxins that lead to local and systemic effects. Some other medications such as non-steroidal anti-inflammatory drugs, corticosteroids, one of the most common ones being prednisone, can also suppress the immune system as well. And a lot of the acid-blocking medications change the pH in the gut and change the microflora in the environment. Also, foods including wheat proteins such as gluten, dairy products, highly processed foods, which we'll talk about later, viral and bacterial infections that lead to gastroenteritis, and other things we might not think about, such as alcohol and stress, can alter the microflora. It's fairly common for us to hear from our patients how often stress is manifested as gut symptoms as well.
Absolutely. All right, well, what can you tell us about candida in the gut? That's been a really popular topic lately that we hear a lot about, so why don't you go ahead and go over that?
Well, candida is a yeast, and it's a part of the normal microflora. It's on our skin, it's in the gastrointestinal tract, and most people may be familiar with this from infections such as oral thrush or vaginal yeast infections in women. And all of us have candida on or in our bodies. But what can happen is there's a disruption in the balance, and an overgrowth of candida can occur even in the gut. So what will happen is the good bacteria die from things such as antibiotics, as we mentioned earlier, or they're suppressed in their growth, and this allows the candida yeast to grow to unhealthy levels, and this causes a dysbiosis in the system.
Yeah, I think we have a really good picture here on the next slide. So you want to explain that?
Sure. If you can see the slide, the picture on the left of the slide is a normal esophagus and has a healthy lining. And on the right, you see the overgrowth of the candida yeast. And you can see that the surface area is much less in the yeast overgrowth slide. And as this yeast overgrows, it spreads and produces toxic byproducts and cause damage to the body tissues, organs, and can wreak havoc in your immune system as well.
Yeah, I think there's another slide that we have here with a really good picture in the gut here. So why don't you go ahead and go over that and tell us about some signs and symptoms of the candida yeast overgrowth.
Sure, and this is actually in part of the small bowel, and you can see once again that the surface area for absorption is much less because of the overgrowth, and you can see the tissue looks fairly inflamed, and it causes a lot of problems in this area when we get an overgrowth infection such as this. And some of the signs and symptoms you might see with yeast overgrowth would include things like constipation, diarrhea, irritable bowel syndrome symptoms with abdominal pain, gas, bloating, indigestion. We even see things manifested as skin rashes such as eczema, psoriasis, see bladder infections, sometimes rectal itching, jock itch, and very commonly vaginal yeast infections that don't seem to clear up.
Yeah, that's a really good overview, and something that I know you probably will agree with is we see this in our at Cenegenics a lot, and a lot of these patients have been undiagnosed and unaware that they have this underlying candida, and unfortunately there's many doctors that just don't really understand the systemic problems that this can cause, especially with sugar cravings and all of the gas and bloating and abdominal issues. So I'm glad you really went over that. And then another thing too that I've worked with a lot of our patients that have, some of them have suspected that they had this and they tried to treat themselves. And you can really make yourself worse. There's something called a Herxheimer reaction that is the die-off of yeast. So when you start to kill this stuff in your gut, it can release some serious toxins, and it can actually make you feel a lot worse. So when patients, when we work with them here, we have to walk them through this process. So I just wanted to mention that. So there's another big buzzword out there when you talk about gut, and that is leaky gut syndrome. So I was hoping you could go over that and maybe tell us how candida and can affect this.
Well, leaky gut syndrome is also referred to as intestinal permeability, and it's a result of damage to the intestinal lining, which we saw in the slides earlier, and it makes us less able to protect the internal environment because it's almost like you opened up the filter and you're allowing larger particles to enter in through the intestine, and some of them even come in contact with the bloodstream and into the bloodstream. And what we'll see are large protein particles from bacteria and yeast, some toxins, incompletely digested material such as proteins and fats and other waste products. And these things will trigger immune reactions, which can lead to additional gastrointestinal problems with abdominal bloating, gas, cramps, food, insensitivities, which we'll talk about, fatigue, joint pain, and again, skin rashes and autoimmunity problems. As you can see from the slide, on the right, there is a lot of surface area for absorption. Things look in pretty good condition there, but then on the right side, you can see that it's kind of denuded or flattened out, and it decreases the normal functioning of the gut, the surface area, which is necessary for the appropriate absorption of nutrients. Leaky gut also allows the candida proteins and toxic products to enter the bloodstream, which can cause systemic reactions. The candida overgrowth we were talking about before, along with leaky gut syndrome, may potentiate food sensitivities, which we have seen a lot in our patients here at Cenegenics.
Yeah, so I work a lot with the patients here with the food testing, so I'm going to go ahead and talk about that here. But first I want to clear up a little confusion, because a lot of our patients come in and they say, oh, well, I've had food allergy testing and it's negative. So they don't really understand the difference between a food allergy and a food sensitivity. So I was going to go over this. Food allergy, it occurs in about 10 or 15% of the population. This is when your symptoms appear immediately. The symptoms usually manifest as anaphylactic shock, hives, or allergic reactions like sneezing, hay fever. It's usually caused by a release of histamine, and this is usually tested by an allergist using the skin prick test to see if it creates a wheal. And that usually means that the person is allergic to that allergen. Most common food allergies that we see with foods really occur in children. Most of the time it's in children, less commonly in adults, but you usually see peanuts and tree nuts, fish, especially your shellfish, shrimp, and then sometimes you'll see milk, soy, and egg. Wheat to a lesser degree in the food allergy. So a food sensitivity is completely different. This is when symptoms appear anywhere from hours up to about 3 days, 72 hours after the ingestion of the food. And this kind of reaction is not associated with the release of histamine. So when you eat these food, it's not causing an anaphylactic shock, it's not causing that histamine reaction, it's not causing the sneezing or hay fever, and it's not going to show up on the skin prick test. we have found this food sensitivity test that we do here in our office to be extremely useful in chronic conditions, and especially psychiatric conditions with more depression and things like that. So here is what the food sensitivity test looks like. It's called an IgG, delayed food sensitivity. It's really convenient. It looks at about 93 foods, and what I love about it is it has a candida marker. So it gives each patient an individualized profile to show what foods they're sensitive to. And there's different categories that it's looking at, from dairy to legumes, fruits, grains, fish, meats, nuts, seeds. It's actually a 2-page report. This is only one of them, but we see reports, believe it or not, that come back like this. And another thing I want to tell patients is, when we get a report back like this, it's not like you can never eat these foods again. What it's showing is that you have a chronic inflammatory response, and you have a lot of gut damage. You have the leaky gut going on. You probably have the candida picture going on, and we need to heal that. So, it usually takes about 2 to 3 months to begin to heal the intestinal lining so you don't react to these foods. So we would want to do an elimination of some of the most common foods, and then we give you the right substances to begin to heal your GI system, along with, hormones and making sure your thyroid's okay, that Dr. Miles will talk about in a little bit. So that is an overview of the food sensitivities.
Well, Tiffany, you mentioned that there are certain foods. What are the most problematic foods that we see, or that we see people react to?
The big ones are what I call the big 5. Wheat is one of the big ones, wheat and gluten, and it's gluten-containing grains, and that can be in your rye, your barley, and some oats. The second biggest one is dairy. There are 2 big proteins in dairy. They're called whey and casein. Also, we see corn quite frequently, eggs, and soy, and then there are some other ones that are a little less frequent, but, the nuts, seafood, pork, some of the nightshades, the potatoes, tomatoes, onions, peppers, brewer's yeast and baker's yeast, chocolate, cane sugar. Those are all what's available on the test. So, but those are the big 5 that, if people have some underlying chronic GI, leaky gut, candida picture going on, we usually see that these are common. And, I'll have a lot of patients that say, well, I don't need the test. I'll just eliminate the foods. And that's okay. That's fine. I will totally work with a patient if they want to do that. The only problem is that I see a lot of patients come back and they just don't ever get a clear picture, and they'll say, well, I couldn't really tell when I reintroduced that food, and I don't know. And so, once we get a snapshot of what's going on in their individualized system, it gives them a reference to be able to say, okay, this is what my body's reacting to. I'm going to go ahead and eliminate it for the next 60 days or 90 days, whatever we decide, depending on the levels, and then we're able to go back and retest, and we'll watch these levels come down as we heal the gut. It's extremely rewarding. I love helping patients when they have chronic GI disorders like this. So, patients should be evaluated for these food sensitivities if they have any gastrointestinal disorders like IBS, Crohn's, ulcerative colitis, any chronic skin issues, rashes, eczema, psoriasis. I'll go ahead and give you a hint. Usually that's wheat. Very commonly, 60–80% of the time, it's going to be wheat. Autoimmune disorders, your lupus, your Hashimoto's, any sort of mental health, bipolar, depression, OCD, and the list goes on, especially when it comes to inflammation. If you have any, arthritis or inflammatory conditions. So. All right, well, I think we've hit up enough about the food sensitivities. Dr. Miles, you've talked about leaky gut and candida. Let's go ahead and talk about a piece that a lot of people, miss out on when they're talking about gut health, and that's, hormones in relationship to gut health. So why don't you tell us about that?
Sure, Tiffany. As you can see from this slide here, it's kind of a simplified slide, and there's a lot more to it, but it does show the interaction that we see. Poor gut health can suppress thyroid function and trigger Hashimoto's thyroiditis, which is the most common form of hypothyroidism. So it can cause low thyroid function, lead to an inflamed and leaky gut, as we mentioned. This inflammation in the gut also affects thyroid function by raising cortisol, which is another hormone, and even excess stress responses can result in high cortisol, which will break down the gastrointestinal lining of the gut and alter the microflora that we discussed previously. And one of the reasons so many of our patients' gut function improves on our program is because we do a comprehensive blood workup that assesses all of the body's functions and not just one area. So I would certainly urge any listeners out there who are suffering from chronic gut issues, autoimmune diseases, or other inflammatory conditions to consider joining our program for a comprehensive evaluation.
Yeah, I mean, I couldn't agree more. I can't tell you how many patients that I've talked to that, you know, they've been to their endocrinologist, they've been to their gastroenterologist, they've been to the rheumatologist, they've been to all of these different specialists, and nobody's putting all of the pieces together and looking at the underlying, you know, imbalances and the underlying cause. So, you know, if someone, any of our listeners out there, you know, have been, you know, jumping around to different doctors and trying to figure out, you know, what's wrong, well, you found your answer. We have a ton of happy patients here that we have been able to restore their gut health and get them feeling better. And I can't tell you, I talked to a patient yesterday who just, you know, feels so good. I mean, they don't understand. A lot of people, if you don't have a chronic underlying gut disorder, how debilitating it can be. They can't exercise. They can't go out and do things. They can't travel. They can't, you know, so when we can start improving that area of their life, they can start exercising more. They can start doing more things, and just life becomes more enjoyable. So it's really rewarding to see that in our patients.
Well,
so,
Tiffany, that reminds me of a few of our patients that we've treated this way recently who had difficult time losing weight, and once we eliminated certain foods, magically they started having the weight loss that they had been really trying hard to lose for a long period of time. So it's made a big difference in their response.
Great. Okay, well, we're almost out of time here. Let's go ahead and just wrap it up, and you can give some of our listeners a quick overview of our approach to what we do here to restore gut health.
Sure. We use a type of a 6R program where we want to rule out the problems. If they're there, we want to remove them. We want to repair the tissues, restore healthy functioning and normal flora, replace what's missing, especially nutrients that they may be lacking, and certainly reduce inflammation, which is a big trigger for a lot of diseases.
Great. Well, Dr. Miles, that was a really, really great overview. I hope our listeners were able to learn some and more about how to heal their gut. And, you know, it's just quite amazing that we've had, you know, Hippocrates, who has said from the beginning, all disease begins in the gut, but here, you know, 2,500 years later, we're all just beginning to make sense of it and understand that he's been right from the very beginning. So thank you all for attending. I also want to let you know about our next webinar that's going to be on sex drive and how to achieve a gold medal in the bedroom. So we're going to teach you how to have an Olympic sex drive. You're going to learn more about the importance of hormones with libido and how to increase sexual performance. It's not just all about testosterone, so join us next month to learn how you can have a gold medal in the bedroom. I think Dr. Barber is going to be on that one with us. So we are now going to stick around, and we really encourage you, if you have any questions out there, go ahead and you can type them up in your chat, and we are here to answer your questions. So please, if you have any, don't hesitate to communicate with us.
Thank you, Tiffany. Dr. Miles and Tiffany, as you just said, will now be accepting your questions. If you would like to ask a question, just please use the chat feature that's located on the meeting dashboard. And the first question that we have, what are natural treatments for candida?
All right, I'll take this one, Dr. Miles. There are a lot of them out there. I can name a few, but just want to encourage you, don't go run out to the store and just try to treat candida by yourself, because with my experience, most patients make themselves worse. There are some big ones like caprylic acid and garlic, grapefruit seed extract, Oregano is extremely antifungal, and golden seal. So we actually have some specialized formulations that I like to use in combination with probiotics. And that's one thing we really didn't get into a lot in this webinar. We feel like it deserves its own webinar, so we may be doing one of those here soon. But probiotics and reinoculating and making the gut flora really healthy is another huge part of our approach. So that's those are the two things that I'll throw out there for that one. Do you have any comments?
No, that was very good.
Okay, good. Are there any other questions? Don't be embarrassed to post. I know we're talking about GI, so sometimes it can be an uncomfortable topic, but we've heard it all.
Okay, we do have one more. What are some of the natural treatments you use to restore normal function of the gut?
Do you want me to take that one too? Yeah, just like I had mentioned before, probiotics. There's some other things too, especially with inflammation. We use a lot of natural anti-inflammatories here. Turmeric is a big one. Quercetin is also one of my favorites. And then there's an amino acid called L-glutamine that is in some of our formulas. But it can get tricky out there. It's real, it's a world of a lot of marketing, and, I would hate just to see patients run off and grab bottles and try to heal this on your own, because it's really a combination of so many different aspects with, looking at the hormones and looking at, the food allergens, and then also, in combination using these different herbs and probiotics and amino acids all together. So, is that another question?
Yeah, it looks like it is. Which probiotics do you recommend?
I'll take that one, Tiffany. Of course, this would depend on the history, maybe medications, antibiotic use in the patient, what type of symptoms they're having. But it's certainly very important that you're taking a pharmaceutical grade probiotic, in high bacterial counts are important. They're also a supplement that requires appropriate care, so you can't really buy these from large warehouse types of stores, because they need to be refrigerated most of the time. They do expire and the bacterial counts will go down, so it's important to have a good quality controlled fresh product to help to restore the normal microflora.
Yeah, I mean, that's a huge point to make. I know some of the companies that we use, they have an acid-proof capsule. And if you think about it, some things that you take, it's going to hit stomach acid. That's the first thing it's going to go into. And if you're taking live organisms like probiotics and it hits stomach acid, a lot of them are probably going to get killed. So you need to have it encapsulated. You need to have these good bugs and the good bacteria encapsulated in a good capsule that's going to make it through the stomach acid and deep into the small intestine and large intestine to be able to heal and repair. So, there are different pharmaceutical grades of probiotics, and some of them are more expensive for a reason, because they do have a therapeutic effect. So let's see, here's another question. I'll go ahead and just read it. Why don't gastroenterologists address these types of food sensitivities when you come in with this sort of issue? Good question.
That is a good question. And sometimes I think that I'll use the saying, when you have a hammer, everything looks like a nail, and sometimes they just want to look directly at the tissues and not some of the tests that they don't get the results back right away. But it certainly is very important to do this type of testing. I know many years ago the tests available weren't very good, but the ones that we utilize now, we suspect certain food problems in our patients, and the test results definitely come back and really confirm what our suspicion was. And sometimes we're surprised, and we do see improvements in our patients when we have them avoid the foods that they have sensitivities to.
Yeah, and I mean, then it also, just comes down to the physician's beliefs and the training. I mean, there's a lot of different training that you can get out there, and one of the things that's just not taught taught in medical school is the delayed IgG food sensitivity. They're just kind of, stuck in their IgE, which is the immediate world of allergens. So it's really new research that's out there. It's only been going on for the past 5-10 years. There is a ton. If you want research on it, if you're a physician out there listening, feel free to email me or Dr. Miles. I can provide you with a ton of research on the IgG delayed food sensitivity reaction. I just think a lot of these gastroenterologists aren't trained in it. It's not part of the regular medical curriculum yet, but I bet in about 5 years, 10 years it will be. So we're just a little ahead of the game here at Cenegenics. So another question, for folks who are highly acidic, does this play a factor in gut and inflammation also?
Well, that question could refer to, acid testing from the urine or high acid in the gastrointestinal tract. A lot of people have gastroesophageal reflux, and that becomes an acid problem because the acid that's normally in the stomach, which tolerates it, gets up into the esophagus, which does not tolerate the acid. Acid is important in our stomach. It's involved with the digestive process, and it's also important to maintain the normal flora. When patients get put on acid suppressing or blocking medicines, which are very potent, we see a lot of changes that happen in their microflora, in their gut symptoms. People often complain of gas and bloating and discomfort just by being placed on the acid-blocking medications. And also changing the acid in the stomach alters the absorption of nutrients at the appropriate place in the gut. So I don't know if that's exactly what this question is referring to.
Yeah. When I hear this question too, it makes me think of, the being highly acidic. Most people, when we talk about acidity in the body, and we talk about foods that we're eating, the standard American diet has an extremely acidic diet, so high in sugar. And when we talk about some of the foods that come back positive on the food allergy or food sensitivity testing is the wheat, which wheat it can be very acidic to the body. So can dairy. It's very acidic to the body. So is meats. Causing acidity. So when you do have a high acidic diet, it is disrupting the microflora that we talked about, and it's causing an imbalance. So we do want to encourage people to get on a diet that is more alkaline, that is more high in whole foods, and the low glycemic fruits that we encourage here. So I hope that answers your question.
We certainly do see a lot more inflammation in people that are on a diet that's high in sugars and high in wheat products. So those things tend to go hand in hand.
All right. Well, are there any more questions out there? I do see one. It's kind of a statement, but I know we have a male out there that thinks he has some symptoms of IBS. Frequent bowel movements with bloating and discomfort after eating, gets a sense of nausea when food's passing through the sigmoid area. He's had no past, no past history of diverticulitis. Oh, you have had a history of diverticulitis, but none in the last 8 years. Okay. Honestly, to me, from hearing your story, I would suspect you have, this would be something we would want to investigate with the candida and the leaky gut syndrome, especially when you're having bloating, discomfort after eating. To me, that would point to possibly something that you're having a reaction to as a food sensitivity. The nauseousness feeling when food is passing, through your sigmoid area. To me, that may suggest, I would think more of maybe wanting to do a detox. When I start hearing nauseousness, I think of food sensitivities, I think of candida, and then I also think of possibly, some toxins. So, we would get you on some things to help bind the toxins and move them through. And with the diverticulitis, you've had a lot of inflammation down there. There's probably some damage going on. So, I'd encourage you to call me. I'll be in the office tomorrow so I can speak personally with you about it and how we can help you, but I definitely think we could. I think that about wraps it up. Anything else you'd like to add, Dr. Miles?
No, I think we've covered a lot of topics. We could delve into each one of them a lot more, but this was, again, a good overview of gut health.
Absolutely. All right, well, join us next month, August 22nd at 8 p.m. to learn how to have an Olympic sex drive. All right, you guys have a good night.
For more information or if you have any questions, please feel free to contact us. Dr. Miles can be reached directly at 843-724-7272, or you can email him at bmiles@cenegenics-carolinas.com. You can also go on our website and register at www.cenegenicscarolinas.com. And just a reminder that Cenegenics Carolinas is open Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. Again, you can reach Dr. Miles directly by calling him, emailing him, or registering online at our website. Thank you and have a great night.